Chronic back pain is one of the most widespread and debilitating conditions in the world, and a significant portion of it stems from intervertebral disc degeneration, a slow, complex process that unfolds at the cellular level. Though disc degeneration has long been regarded as an inevitable part of aging or wear and tear, newer research shows that it's not just mechanical erosion that drives this condition, but also a cascade of cellular dysfunction and chronic inflammation. Understanding how these microscopic changes lead to macroscopic pain helps reframe the way we approach spinal health and opens the door to more targeted, regenerative strategies. Intervertebral discs sit between the vertebrae of the spine, functioning as shock absorbers that allow for flexibility and load bearing. Each disc is composed of a gel-like core called the nucleus pulposus, which is surrounded by a tough, fibrous outer ring called the annulus fibrosus. In healthy youth, these discs are hydrated, resilient, and metabolically active. But over time, due to factors like repetitive stress, microinjury, poor nutrient diffusion, or oxidative damage, the cells within the disc begin to deteriorate. One of the earliest signs of this shift is a change in the behavior of nucleus pulposus cells, which begin to produce less proteoglycan, a molecule essential for water retention, and more catabolic enzymes that degrade the surrounding matrix. As the disc loses hydration and structural integrity, it becomes thinner, stiffer, and more vulnerable to tears or bulges. But the physical changes are only part of the story. At the cellular level, a more insidious process begins: inflammation. Senescent disc cells accumulate with age or injury and begin to secrete pro-inflammatory cytokines like IL-1SET, IL-6, and TNF-A. These molecules amplify the degradation process, recruit immune cells, and create a chronic inflammatory environment that accelerates damage while also sensitizing nearby nerve fibers. This inflammation doesn't just break down tissue, it also acts as a signaling mechanism that can generate persistent, radiating pain. In particular, the ingrowth of nerves and blood vessels into previously avascular and neural areas of the disc is a hallmark of degeneration and a key contributor to chronic pain. Under normal conditions, intervertebral discs are largely isolated from nerve endings. But in degenerative states, inflammatory signals promote the sprouting of sensory nerves into the inner disc layers, where they become exposed to biochemical irritants and mechanical stress. This abnormal innervation, combined with chemical sensitization by cytokines, explains why disc degeneration can evolve from a silent structural issue into an intensely painful condition. The surrounding vertebral bone and adjacent muscles may also become involved through a process known as cross-sensitization. As disc cells release inflammatory mediators, they can affect not just the disc itself but the nearby tissues, leading to changes in spinal loading patterns, muscle guarding, and even central nervous system sensitization, where the brain begins to amplify and perpetuate pain signals. What makes this emerging understanding so impactful is the shift in focus from merely viewing disc degeneration as a mechanical failure to recognizing it as a dynamic, cellular-driven disease. This opens new avenues for therapy, not just spinal surgery or pain management, but biologically informed interventions that target inflammation and cellular dysfunction at their root. For example, research into regenerative therapies like mesenchymal stem cell injections, growth factors, or senolytics aims to restore disc health by modulating the cell environment, clearing senescent cells, and reducing the inflammatory load. Some experimental treatments even involve gene therapy approaches to reinstate normal proteoglycan production or block catabolic enzymes. In parallel, lifestyle strategies that reduce systemic inflammation, such as regular physical activity, weight management, anti-inflammatory nutrition, and stress reduction, may also contribute to slowing the degenerative process and supporting disc resilience. Because spinal discs have limited blood supply, maintaining systemic metabolic health is key to ensuring that disc cells get the nutrients and signals they need to function properly. Ultimately, back pain caused by disc degeneration is not merely a product of age or bad posture. It's a reflection of cellular imbalance, immune dysregulation, and chronic biochemical stress. The more we understand these underlying processes, the more we can move beyond symptom management toward meaningful, disease-modifying care. It's a hopeful perspective that reframes spinal health not as a passive decline, but as something actively influenced by biology, behavior, and innovation.